Hello, I'm Corinne Story. I'm a registered dental hygienist, and I am making this video because I see many patients who have severe periodontitis or gum disease. And when I'm working with my patients who have any form of gum disease, whether it be mild or severe, I always recommend that they use an electric toothbrush. There are a few good models out there for purchasing. However, this specific video will be on the Sonicare Flexcare Platinum model. I want to thank Sonicare for providing me with this free sample. Companies often do that for dental hygienists so they can try them out and hopefully recommend them to their patients. So this particular model or toothbrush is quite good, and for a few reasons. One being that it's quite technologically advanced. It has an application, so you need Bluetooth to use this application, and it allows for you to receive feedback on how effective you are brushing. Now, again, this is not a replacement for getting feedback and from suggestions from your dental hygiene professional. However, it's a nice addition and can be helpful, because sometimes even though you're accessing a certain area, you may still be not getting all the plaque for some reason. So again, it's good to see your dental hygienist. So yeah, in addition to it being technologically advanced, when you purchase it, it does provide a video for you to watch on how to brush your teeth, which is quite good. However, I think I can offer you some additional suggestions that you might find useful. Now, it comes with 3 heads. It comes with what I call the standard head, and they call it the adaptive clean brush head. In the video, they recommend that you use a 45 degrees or a 45-degree angle towards your gums when you use this toothbrush, and I agree with that. However, you might need to lift the brush after you've done your full mouth with the 45-degree angle. You may need to take it a little bit higher and use more of a 90-degree angle to get the higher portion of your tooth, or each tooth. And in it also, you should be taking it along the tops of your teeth or the chewing surface, because they have in the back, lots of grooves for plaque to hide. So yeah, and I would recommend that you use it at the lowest power setting or lowest vibration, because it takes a while to get used to the vibrating in your mouth. I suggest that you resist using any additional pressure or scrubbing action and just use what is already provided by this toothbrush, because if you use a hard pressure or press too hard and use a scrubbing motion, you can actually do some damage, and I have seen that. So it is important to use these electric toothbrushes correctly. And this toothbrush has 3 settings: clean, white, and deep clean. Again, I would recommend just starting on the regular clean. It makes a it uses ultrasonic waves to help break up the tartar, and it does actually kill some of the bacteria in the plaque. So I use the word tartar. There is a difference between plaque and tartar. The electric toothbrush generally won't remove the hard tartar, because once it's calcified, the plaque, that is, has calcified on your teeth, you will need to see a dental hygienist to physically remove that deposit. the plaque is the soft deposit that can be brushed and flossed off. So yeah, I just had to back up because I accidentally used the word tartar, which I didn't intend to do. So yeah, brush with your mouth open and use that 45-degree angle. You're going to have to do the outside of your bottom teeth, the outside of the top teeth, the inside of the bottom teeth, and the inside of the top teeth, and then again the chewing surfaces. So try and hold the brush for 5 to 10 seconds in each spot, and it will do the work for you if you're just holding it there. So I'll demonstrate on the outside of my bottom teeth, and I'm going to start at the front, but you can start at the back. So it's as simple as that. Now to do the inside, you're gonna. I find a lot of people on the bottom miss on the inside by their tongue. You have to get your tongue out of the way. You actually can put the toothbrush in between your tongue and your tooth, like so. And also position the brush so the stem or arm is horizontal and parallel with the teeth. Not like that. So not like that. Okay. And then when you do the inside of the front teeth, it might be hard to have the toothbrush horizontal like this. There might not be enough room. So you can turn it vertically and do one tooth at a time. Like that. And the top is basically the same way. However, when you're trying to reach the very last tooth on the top, depending on which side, it helps if you swing your lower jaw to one side, if you can. Some people can't do this. Like that. So if I'm swinging it to the right, it gives you more space to get back there. When I'm viewing this and looking at myself in the video, it's backwards, so I have to think as to which side I'm actually doing. It's tricky. Anyway, it takes practice. Just like using a dental mirror. Now, okay, so that's the standard head. And in addition to the standard head, if you have gum disease, I'd recommend using the brush that Sonicare has for the gum health. It's called Pro Results Gum Health Brush Head. It's a little softer than what I call their standard, and definitely use this with a 45-degree angle along the gum line everywhere. And however, it's quite small, so it may not be reaching the other areas of the tooth. So then use your standard toothbrush, again, just to get a little higher and to get more tooth coverage. So I would suggest actually using 2 different heads if you have gum disease. Now the last head that is with this toothbrush that is called the Intercare brush head. And it's designed so if your teeth are a little bit out of alignment or crooked, I actually have a little bit of crowding in my front teeth. This can help reach some of those areas that you might miss because a tooth is not aligned with the other ones. Yeah, so I think that's all I had to offer you with regards to brushing with your teeth open and brushing at 45 degrees towards the gum line. Make sure you still do cover the other areas of the tooth surface though. To swing your jaw to one side, bottom jaw, or the other, depending on which side you're trying to reach the top last tooth. And in addition to that, brushing for about 2 minutes. You can use the the app with this toothbrush again. And with regards to toothpaste, I recommend using about a pea-sized dab of toothpaste. And I think that was it. Now, importantly, if you have severe gum disease or your gums are not healthy in any way, diet and nutrition is very important. I'm actually right now drinking a green smoothie with all organic fruits and vegetables to help with my overall health, which will impact my gum health. And on the note of nutrition, I'd like to recommend this book called Veggie Mama, written by Doreen Virtue and Jenny Ross. You might be familiar with Doreen Virtue. She is quite known for her angel cards. So by recommending this book, I am not admitting to or denying a belief in angels. I just think it's a very good book with regards to nutrition for overall health. And it also talks about nutrition from an ethical perspective because it is vegetarian or vegan. So I appreciate that from an ethical standpoint. And yeah, this is important. Your diet and nutrition is important because your overall health and your oral health, or the health of your gums, is very connected to the health, or to the overall health of your whole body. And I've mentioned this in a previous video. So yeah, a few suggestions for today. I hope that helps. I feel like I'm forgetting one thing with regards to using the toothbrush, but I'm sure it'll come up in another video. Thank you very much, and good luck. Again, I can be reached by my email address that I have provided in my YouTube channel. Thank you for your time.